Okay. So welcome everyone on board. So before we formally start the discussion, there was a question by one of our candidate who is a resident, and he's asking about a midway exam of our training program, which is called as IMM, or in the other, the abbreviation is intermediate module. Okay, so in different parts of world there are different criterias of evaluation during the training period. So in Pakistan we have 4 years training program, and after 2 years there is one in between exam which is called as intermediate module. So actually, the concept of this exam initially was because the usual assessments are being done by during the training program are being done, and this is actually a full dress rehearsal of the final exam. Okay, so the basic concept should be that you should be preparing as if you are preparing for FCPS part 2. Okay, because there is no difference between FCPS part 2 and IMM, and and actually, IMM is more tricky because IMM has basic sciences as well. However, the FCPS Part 2 have relatively less basic sciences. Okay, so there is no differentiation that you can filter out that this question or this point is for FCPS Part 2 and this part is for IMM. Yes, you will find maybe out of 200 questions, maybe you can say that 100 questions difficult and 100 question easy in intermediate module, and that will be more in FCPS. Like there will be the difficulty level will be more in FCPS part 2. Otherwise, practically speaking, there is no much difference between intermediate module and FCPS part 2. Now, how to study that? For that thing, I have just conducted this session today, and our purpose is main that how to study, because people don't know how to study, because unfortunately, even still anesthesia is still a growing specialty, and in my opinion there is no single so-called, I will use the word so-called, textbook which you can say perfect, because anesthesia has everything other than anesthesia. Anesthesia has very little anesthesia. Everything else you should be knowing. Like if you want to study about CVS, from where you should have start? You should be starting from the physiology. If you don't know what the physiology is, how the cardiac system works, how is the structure of cardiac cell, how the conducting system of heart is occurring, how the like cardiac muscle works, you cannot understand the pharmacology. And if you don't understand pharmacology, you will have all the problems in the world during attempting even MCQs or even conducting the anesthesia, practically as well as theoretically. So you should be knowing all the physiology, pharmacology, anatomy, the functional anatomy, in the same way that you should be knowing about the basic structure of the heart, how the chambers are working, what is the valve size, what is the nerve supply, what is the blood supply, venous drainage. Okay, so if you don't know, how will you able to understand? Like if you want to understand valvular heart diseases, how can you do it without understanding the physiology, how the normal cardiac cycle occurs? Because if you don't know the cardiac cycle, you how will you understand what happens in the different pathologies of valvular heart disease? Okay, so in this regard, unfortunately, there is no one single text which will you will be able to get all the information. So you will have to gather it. First of all, should be knowing what are the things to do, what are the targets, what are the goals in a specific topic. Till the time you don't know, you cannot progress, you cannot understand, and then you will be edgy, you will be patchy. Okay, just like if you have a patchy spinal. Okay, so similarly your knowledge will be patchy, and maybe you are able to answer the MCQ and maybe you are not able to answer. So the problem arises from there. So till the time you don't know what are the different aspects which you should be knowing about a specific topic, unfortunately, you cannot study. Okay, so I will just try to tell you some sources how to study. First of all, how to chalk out. So, know your enemy. Till the time you don't know your enemy, what your enemy is, how you will be able to perform. So, first of all, the basic thing, you have to sort out what the topic is. And as I have told you, You should be always be starting from the physiology. You should be starting from physiology, and then physiology will become pathophysiology. So if I give you an example of this valvular heart disease, till the time you don't know how the coronary supply occur, what is the myocardial oxygen demand supply ratio, what are the factors which will be affecting the myocardial oxygen demand supply ratio, how the cardiac cycle occurs, what happen is in a specific valvular heart disease, how will you be able to understand the topic fully? And then what are the other organ system which are being involved? The other organ system will be like, for example, lungs. Immediate involvement will be of the lung, and then the lungs will be leading to the right side of the heart, and from the right side of the heart, of the other involvement will be of liver. Okay, and if the cardiac output is not being maintained, then the kidneys will also fail. You will have chances of stroke, okay, because of hypercoagulable state or because of embolism, which can occur because of stasis of blood in. So I hope you understand. So that's how you should be studying. Okay. So it's not the book, it's the topic which will guide you how to study and what to study. Okay. So first of all, for any topic, do a post-mortem. Okay. Do a post-mortem about that topic. Okay. I have done a number of topics in details in that way, and you can have a look on this in this folder. If you go here, and there is a folder of topic wise questions. Okay. And I'm not able to make questions for all the topics, but I have make questions for a number of topics. Okay. Like for instance, if I just give you, for example, this is hypertension. Okay. So if you want to understand about hypertension, you will be going, if you want to really understand what hypertension is, you should be understanding how the blood pressure is being controlled in the body. Okay, how the blood pressure is being controlled, what are the determinants of the normal control of the blood pressure, what are the different reflexes which occurs in the form of Bain-Briggs reflex, baroreceptor reflex, what is the immediate control, what is the intermediate control, what is the long-term control. So from there onwards, you will be able to understand the pathophysiology, or you can say the what happens in essential hypertension. So what is the role of renin-angiotensin system, what is the role of the central nervous system, how the what are the effects of hypertension on heart. So you will be understanding in that way. So for that thing, again, you will have to start from the basic. So if you want to and if you are for understand this theory, you yourself will be targeting from where I should study. So for basic sciences, the best books will be the from the basic sciences. Or as I always guide or tell all of you, that the review articles. I would like to ask any one of you, do you know what is difference between a review article and a research article? Dr. Sumera, would you like to tell? Or Pardeep, what is difference between a review article and a research article? Or Dr. Hadika, if you want to tell. Anyone, anyone. Your mic is unmute. So anyone wants to tell what is difference between a review article and a research article?
The review article is article which is already in a process, or it uh, occurred before. And research article is that in which we are doing research, new things.
Not necessarily. Not necessarily. Research article, if you are having a hypothesis and you are doing something and you prove something, and then you publish that I did this research and I find this thing better. This is research article. Okay. And for example, on the basis of maybe 10, 20, 50, 100, according to the topic, the summary and chunk of all the research which is being done, a review article is being written. Okay. I repeat, a research article is on, for example, if we say that there is a pain with propofol. Okay. So propofol pain is being attenuated or decreased by a number of ways, by giving fentanyl, by giving lidocaine, by giving ketamine, by diluting it with normal saline. There's so many ways. Okay. And all these were research. In fun research, you find fentanyl to be better, and other research, lidocaine will be better, and ketamine. And at the end of the day, from the all the research, now you find an inference that among all the things which were being used, this is the best. So that will article which you will be writing on that topic will be a review article. Okay, that will be the similar thing will be of all the diseases. So review articles are being taken away from the all the sources. It may be review, there may be some data which is being collected from some books as well. Okay, but usually the review articles, like for example, I just because today I'm just making you understand how to study. Okay, because unfortunately people are in the same mentality, sir, which book we should read, and then everyone is telling every different sort of books, and then you are not getting the result. Okay, so if I just take the example of hypertension, this is the data, and this is articles which I have arranged topic wise. Okay, unfortunately, since last 1 or 2 year, I'm unable to uh, fully update the folders. So some of the folders are still lacking, but I will tell you how you can overcome this thing. Okay, so you will go to this folder, and then you will go to cardiac. Okay, and then you will go here, you will find cardiovascular physiology and diseases, and here you will find the cardiovascular diseases. Okay, it seems difficult, but it's very easy. You will find a number of articles on hypertension. This is hypertension, this is hypertension. Okay, uh, so like for example, this is an old article. Okay, but the pathophysiology you will be finding it in a very nice way. Okay, so you can find a number. Again, the thing will be that you are looking at the extent which you should be knowing about that topic. Just a second. Yes, this one. I'm sorry, I opened the wrong one. Okay, hypertension pathophysiology and treatment. So how to read this? You will open this and you will see the key points. Okay, you will find some like definitions, or like in that case, what are the different guidelines, what are the different classification. Then here you will find, you see, you are the beauty about these articles is that they are covering the topic in a very nice way. Okay, so remember one thing, some things need to be updated. Like this article was published in 2004. Okay, so if someone is with reference to classification or guidelines, maybe this article is an older one, but the basic physiology and basic pathology never change. So you will see in a very nice way they are telling you about, for example, here they are telling you about neurogenic control, renin angiotensin system, this what is the role of ANP, what is the role of this leukotrienes. Okay, and then they are telling you the basic pathophysiology like salt and water excretion. You will find it in a very nice way, which is not there usually in the books, unfortunately. Okay, so like so these are some things about the treatment as well, because once you know the pathophysiology, then you will be able to then you will be able to understand the treatment as well. Okay, so in the same folder you will find like this is a relatively new article. So instead of reading this, so it will take few minutes for you to understand what data is there, and then you will find the thing with the good thing will be that you will find almost all the things which you need about hypertension in this folder. You will find, maybe you need to open one of them. Some of them thing you will find in one source, in the other thing in the other source. So I know that it looks very difficult, but there is no escape. Okay, because till the time you don't cover a topic from different aspects, you will not be able to attempt the questions, and you will have missing concepts. Okay, so in the same folder you will find antihypertensive medications. I had put it here somewhere. um, I think it is in the other folder. Okay, also I have put here this GNC. So I think this is the latest one, or maybe GNC 9 has also come, because that's what I told you, that some things are still missing. something are still missing, and I think there is JNC 9 also which has point. Okay. So at the same time, if you want to just confirm this, you will see, is it the latest one? So you will find here JNC 9 is there. Okay. Mm, so start searching how learn to know, learn how to target a topic. So this will be the way. Okay. So you will just find latest guidelines like that. So guidelines should be the latest one. Guidelines should not be the older one. Okay. Any question or any comment up till now? I hope you're understanding what I'm trying to tell you. That you will take a topic, you will try to understand what are the goals which you need to learn from that topic. Okay. And then you can read it from your book as well. But the thing is that if you want, I have found these articles much easier, much compact than this one, which I call them so-called uh, this one textbooks. Okay. So this is just, I'm just telling you. Okay. So because the next step of hypertension will be failure. Okay. So the same thing you will find if you just have a look, you will find, or like for example, arrhythmias. Okay. So for arrhythmias, remember, because arrhythmias are being the pathophysiology will not change, but the guidelines you from where you will follow if you want to learn what should be the treatment of the specific arrhythmias, what source you should be looking at. Yes, Pardeep, will you tell or anyone?
ACLS.
Yes. Okay.
ACLS.
ACLS. So though you don't need to, you can read about the pathophysiology from there. Okay. But if you want to be exactly knowing what is the drug of choice, what is the guideline, you will not follow this. Okay. You will find some basic things which will be common. Like here, like I have discussed in detail, what is the basic approach to what is the basic approach for any arrhythmia. Whenever you have any arrhythmia, you will try to see whether it is stable or unstable, um, like what are the possible causes, things like that. And your approach will be the common airway breathing circulation, and then the drug of choice you will take from the ACLS. Okay. So because actually and I'm not discussing a specific topic today, inshallah, because I have tried to restart the thing which I used to do, and conducted I have spent a lot of time doing all this. Okay. And I have made these links all for you. So but because I am a one man show, I'm unable to update 100%, but majority of them things are updated. Okay. So the other thing which can compensate this thing, because since last few years I'm unable to update regularly, but these are four sources. This is other link, year wise review articles. Okay. So you can take the topics from here as well, like the latest BJ education articles which have just come, even you will find here. Okay. And you can say this is the latest one. So maybe you're not all you don't need to read each and everything. Okay. Because the people who are already have baseline knowledge, like not the first year residents, like you have already covered the courses. Like yesterday I was talking to one of the resident who is in final year and is preparing for the final exams. So I just told that I told her that you can start like that. Like for example, this is a topic which is you will not find in usual books. So this is pelvic exentration surgery. So even before I have a look, you can just think pelvic exentration. Pelvic exentration, you are trying to remove everything. Okay. or you will be removing a lot of part of the pelvic organs. So of course the reason will be a malignancy. Okay, so whatever you will be thinking, that according to again, as I discuss always, that always approach a topic with reference to patient identity, the disease and the surgery. Okay, so disease here is for example cancer. So you should be knowing the general concerns about the cancer. So general concerns are with reference to the site of the tumor, the nature of the tumor, any hormones being secreted, then the local spread, then the spread to the lymph nodes, then the spread to the distant, like lungs, liver, bone. Okay, this will be one thing. The other thing will be any vascular structure being involved, because if there will be vascular structure being involved, the tumor will be very dangerous because it will bleed a lot, bleed more than even the normal. Then the treatment. The treatment may be in the form of radiotherapy, chemotherapy. Okay, and the medications of chemotherapy will have their effects. So you should be knowing the effects of chemotherapeutic agents with reference to bone marrow. Bone is something else, because bone metastasis will be leading to bone fractures. So if you find a patient with pelvic exentration surgery, nobody will tell you. You have to tell these things, or you have to think about these things, that this patient will have chances of bone metastasis, and you have to handle the patient with care, because maybe patient will have fragile bones, and patient they which can do like you can easily fracture them. Okay, so similarly chemotherapeutic agents have bone marrow effects, liver effects, kidney effects. So you are just doing and then you will find the same thing which I am telling you. It's latest, I have not even have a look, but I'm telling you that how to proceed with it. Okay, you don't need to read all each and everything. This is just, you can say, this is a topic for your interest, in the sense that maybe this question may be asked in the exam, because at least for international exams, and even I tell you something, I used to share all these articles to all the faculty members and whosoever I can share with them, because I have dedicated these things for everyone. And plus, actually, sometimes they are taking the new topic which are being published in the authentic sources, and at least the Irish fellowship exam or the British fellowship exam or even European diploma in anesthesia and things like that. Definitely, these are the sources from where they take the questions. Okay. For you, you don't need to read each and everything. You will just have a look. If something new you find, you can just pull them out. Okay. So, like this is one of the example I'm telling you. So for even for similar to pelvic exentration, they also do a surgery which is some of them know about it. Its name is HIPEC. Okay. HIPEC surgery. So HIPEC surgery is hyperthermic intraperitoneal chemotherapy. Okay. So it is sort of, you can say, they are removing the tumor and then they are circulating chemotherapy under high temperature. And their theory is that it will result in a better outcome with reference to recurrence. The chances of recurrence will be decreased. Similarly, in the same, they are also doing in different setups, the specific, they are doing intraoperative radiation therapy. Okay. In which they are actually, they remove the tumor, they do the IORT, and then they do the HIPEC. That's the routine which they do in the centers where they are doing it. Okay, so they are focusing the radiation. That's what it's written here. Intraoperative radiation therapy. Okay, so not very like intraoperative radiation therapy. What are the concerns? The patient should be fully paralyzed. Patient should not move at that time, because it's a very specific small beam. You see, electron beam radiation which is being done. Okay, so you should be very, and you can have some information which may be asked in your exam. Okay, so I'm just giving you a hint. So similarly, you will every month you can take some of the topics from these, like collapse newborn in the emergency department. This is correctum, this is those correction they are putting. Okay, the other topic which here, strategies for successful lumbar neuraxial anesthesia analgesia in patients with challenging anatomy. Okay, So this is a topic you can have in that way, that how, like, what are the different problems you can face in a patient with different, like, kyphosis, or previous spine surgery, or short heighted, okay, very obese. So there are so many things which we may be reason for this thing, and how to do it. You can, like, have in radiological investigation before, okay, to see the abnormality over there, and then you can use ultrasound, okay. So the same thing that you will be finding here. They will be telling you about paramedian approach, use of ultrasound. There will be something like that, okay. So of course these topics are, you see, a spinal ultrasound imaging. So you will find there are in detail some top like about this spinal ultrasound, but I'm just giving you a hint that you will how to use these sources to learn in a better way, okay. So in every new like chapter, you can say, you will find some of the new topics which will be helping you, like pediatric neurosurgery. Okay, so pediatric neurosurgery, common neurosurgical procedures in children. So, like, okay, so I have arranged all these articles and make your, if you know, remember one thing, if you want to just keep yourself just confined to a very small tunnel vision, okay, fine. You can do it with your so-called textbooks. I am using the word so-called Morgan or Miller or whatever you are saying. But actually, it's first of all, Miller is a very big book. It's really difficult to swallow Miller. I don't think so. All over the world, average student. I'm an average student, and I'm talking about average student. Not talking about above average students. For average students, it's very difficult to learn. And another thing I want to clarify, that any book which is being published, for example, you get the latest edition of any book today, for example. So you think that this book must have been printed at least 1 year ago, and it is proofreading and things like that. So you will not find anything. And now the new edition will come in 2029. Okay. So there will be nothing new in between from 2023 to 29 in 6 years. Nothing new will be available in that book. So you just have to top up your knowledge, because you will find every day something new, something new. Okay. Like I give you an example. In 2012, when I was appearing in the exam, this Berlin definition of this ARDS came. So it was something new. It was not written in any of the book. Now it is available in the books, but maybe after some time you will find something new. Like recently, few years ago, after that, in again when I was appearing in Irish Fellowship exam in 2016, actually they added. Can you mute your mic, please? They added this new criteria for sepsis. Okay, so new sepsis guideline came actually at that time. And now in, I think, 2021, again they added something. So you just need to update yourself, otherwise you will be very lagging. Okay. So this is I just wanted to tell you. So these are four sources. Okay. And if you, any one of you want to, and you, and another way you can write, for example, if you want to have ARDS, okay, you will write here and you will find something. Okay. So, like, you can search like this as well. And the best way will be that you go to the latest year, take the topic, and maybe even, I tell you something. If you take the topic from here, you can open your book as well if you want to learn like that. But that if you want to be updated and you want to learn the best thing, you have to learn in that way. Okay. This source is also very good. I will tell you. This is actually I don't exactly, there is no specific name of this journal. This is Elsevier. So actually, this is more compact even than British Journal of Anesthesia. And every 3 to 4 years, they repeat their curriculum. Okay. Every 3 to 4 years, they repeat their curriculum in the whole. So you don't need to go to old articles. But I request you to please mute the mic. It's really disturbing for me. Okay. So like, for example, this is the latest one. Okay. So I was just, this is a wonderful topic for you to learn how to do it. Acute kidney injury. Okay. Acute kidney injury, actually every day we are facing a scenario in which maybe our anesthesia care is leading to a patient with possible renal risk going into renal injury. Okay. So if you want to understand this topic, for example, I'm just giving you an outline for this topic, for instance, that you should be knowing what are the renal risks. Okay. Renal risk you should be knowing, and you should be thinking that if you find any patient, like any diabetic patient, especially with insulin dependent, this is a renal risk. But even then, patient is always having slow nephropathy, which will be occurring in those patients. So if already they have some base, like you can say baseline renal impairment, now you are having a surgery in which there is hypotension and hypovolemia. So this will be another one. And now you did not give good fluid replacement, and you also gave NSAIDs, and you also use some contrast, and you also gave some aminoglycoside antibiotic. Now, most probably, the patient will have renal failure. Okay, so you will have to be careful. If you have a diabetic patient, try not to have hypovolemia. Try to maintain the perfusion pressures of the kidney. Can anyone tell? I'm just trying to make you people interactive as well. Can anyone tell what is the autoregulation values for renal perfusion? What is the limit for autoregulation of renal vasculature?
Sir, blood pressure you mean, sir? Perfusion pressure?
Perfusion pressure.
80 to 180, 80 to 180
This is what?
mmHg.
This is what?
Sir, MAP, mean arterial pressure.
Very good. Okay, mean arterial pressure.
Thank
So this is why it
Yes.
is important. Why it is very important, because usually we don't remember the word 80. We are only interested in 60. Even if we are giving controlled hypotension, the majority of people will be giving it 60. Okay, so it's very dangerous. So you are posing the kidneys at risk. So you have to filter out. Like if, for example, if someone is asking you to have a sustained hypotension for instance, for example, 1 to 2 hours, okay, fine. But if you are keeping it for very long, your kidneys will be at risk. So you can say that this patient has adequate renal risk. So I cannot keep the patient at so much hypoperfusion, because the autoregulation is higher than for brain. For brain, if it is 60, for kidneys it is 80. Okay, this is, I'm just giving you a hint. So similarly, like then you will be needing to have this rifle score or Akin criteria, and there are so many. You will find all of them here. Okay, this Kidco. Okay, so like this is rifle. This is you will find some renal risk factors. Okay, because this topic, this article is specifically is with reference to ICU patient. Okay, so in ICU patient, you will find something extra other than which are being you there in the a normal OR. You will have something extra, like here you see there will be some extra factors. The ICU patient will be even at more risk than the normal patient. Because this patient will maybe with having high dose of vasopressors. Okay, these patients might have some multi organ failures. The patient may be taking some antibiotics which are damaging the kidneys, things like that. Okay, so the beauty of, the what is the advantage of these articles, that you will find everything about that topic available there. Majority of the things you will find in and if you are having, you can have one article, you can read properly, and then you can add on with things right around and around. Like in the same setting, you should be knowing, you can read about dialysis and CRRT. Okay, in the same, starting from the basic renal physiology, to up to dialysis. If you are studying a specific topic in that way, you will like we be in a better position. Okay, they have written here. Okay, renal replacement therapy they have written here. Then you say rhabdomyolysis, then intraabdominal compartment syndrome, which is more common in ICU patients with due to a number of reasons. Okay, but you like uh, this is how you can have even you can make your own list, and that's what I always and repeatedly I tell them that a paper which I have made here for all of you. If you make a printout, especially the junior residents, I will suggest that if you make this printout of this paper, and every case you try to rule out what are cardiac risk, what are pulmonary risk, what are renal risk, what are respiration risk, PONV risk, airway management, special monitoring. If you make your own, you can modify. This is not something perfect. You can make your own, but two things will be, one will be with reference to the disease, one will be reference to the surgery, and one will be reference to the anesthesia. So all the anesthesia steps you can think, and okay, this patient, what preoperative things I need to do. A number of things which actually are being done, sometimes you miss. Okay, like if, for example, if you have an obese patient, this is the number of things you have to prepare preoperatively. In addition to all the workup of the patient, there will be logistic things in the OR which you need to do. That will be with reference to special equipment, special table, more manpower, and things like that. DVT prophylaxis, you need maybe a bigger table, a bigger BP cuffs. You might need to have arterial blood pressure monitoring. You might need to have DVT prophylaxis, this compressible devices. There are certain things. Okay, so I'm just giving you a one hint. So if you put your brain in like headings, you should be knowing, and you can put all the cases in that format. Okay, just a second. So sorry. So if you want to, because I'm trying to I am not able to get proper time to do it, but yes, you see kidney, I just you can see here the remaining articles with reference to renal, and you will find all everything here. You will find with reference to RRT, with reference to AV fistula, chronic renal failure, acute renal failure, like whatever things are available, you will find here. And then you can just extract, because till the time you don't do like this, unfortunately, you will have missing concept. Okay, so I'm trying to put it them in one link. I'm not able to get the time, but still you will have two links. One is for this one, which is the year-wise. Okay, year-wise article. It has anesthesia tutorial of the week, this PG education, these article, and this is updates. Okay, like for example, this is also a wonderful source, like the latest one which came in for pediatric anesthesia. So you can have a very good coverage of pediatric anesthesia from here. Okay, so this is one source. The other source I told you that these are the topic wise. There are some deficiency in it. I'm trying to uh, make them a better one. And then, for example, if you want to, you don't understand from there, and now you want to read from basic sciences. So you will come to this folder of books. You when you open this, you will find different folders. So now you are thinking about basics. You will go here, basics review books, and you will find so many basics review books. You can take any one of them. You can open. This is also good. This is this is master pass. Okay, and this is here also podcast. Okay, so this is podcast. So you can go here, open the index, and you will find the topic, and you can read about it. So because now it's era of multimedia, so you should, all of the residents should have a good internet connection, and you should have a tablet. It's my suggestion to read, because this investment which you will do for studies will never be lost. Okay. This is something you should be thinking. Now you want to have, like, for example, you some people are not using these SAQs books because they are saying that it is not in our pattern. But anyone who is planning to appear in Irish fellowship exam or FRCA, they all still have written pattern. Okay, so you can just keep yourself have a taste of it, and you don't need to read the answers fully. You can just take a question. Okay, you can just take a question, and then you can compare it with what knowledge you have. And even if you don't have the MCQs pattern, you will have a lot of knowledge from here. You will have a lot of knowledge. Forget about this, the answer. What are the characteristic neurological changes occur immediately and in the first 3 months following transaction of the spinal cord at T4 vertebra? Okay, so you will find the like you can think in with your knowledge, and then you can compare your answer with which is there. So this is a big practice because the same question with a little similar way will can come in the oral part. Okay, and even in the MCQ, if the MCQ is coming, the knowledge will be maybe based on this knowledge. So if you are in habit of using different multiple sources, and then whatever information you gather something new, you can just have a sticky notes and you can put it on your book. Or another way which I tell to everyone, try to make audio notes. This is, I think this is the best. Share the link of books and folders. If are you not in the my anesthesia knowledge group? If you are not in the anesthesia knowledge group, I will suggest you. I can just share the link here. You can just drop a message of what's on WhatsApp and I can share you. Okay.
Perhaps I am not in books.
Okay. Okay. So you just message me on WhatsApp and I will share. But I actually, the people who even the link which I share today, the link which I share today to all of you has the link
Okay,
of these folders. But I
okay,
think you have
thanks.
not seen it. Okay, because
Okay, yes.
in the Google Drive link which I shared today has the link of all these things which I'm showing you. Okay, so these are SAQs books. These are having some sample OSCE books. Also, there are ECG books. Okay, there are ECG books here. You can find a number of ECG books. There are ABGs. Okay, here you can see there is a very book. Some are very detailed book, but also some practice books for ABGs. Okay, and this is for X-ray. You see a number of things which can help you in understanding the X-ray. So okay, so this is with reference to ICU. Uh, a number of people ask about this basic sciences, but I will suggest you that you should read monitoring and equipment from the monitoring book. I read from this book. This is, in my opinion, this is a better book than Bahal Sheikh, but Bahal Sheikh is also good. Okay, you can again compare from either of them. Okay, another, the people who are appearing in basic sciences exams, EDA or FRCA primary or things, this is a wonderful book for a revision. Okay, and even for example, the other people who you are studying, if you finish any chapter and you and like for example, if you want to a quick review of respiratory physiology, okay, my suggestion to you, click here, go to the respiratory physiology and just have a look. You will find not only the graphs, they will tell you how to make the graphs. This is a wonderful book for these things. And even in they can ask you to draw in the final exam. Okay. Okay. So these are some of, and remember one thing, these are all similar books. Don't be confused. I will ask any lady, when you open your cupboard and you find hundred of dresses, do you ever confuse yourself? No. You will have specific dresses for party wears, for casual wears, for night dress, for hospital, for going with family, things like that. So use these sources as a library. Okay, Maybe some topic will be good in one book, some topic will not be good. And so you can, if you don't open from here and you are trying to understand diathermy, you don't understand, open the second book, open the third book. This is all for you. Okay. And you don't need to show it to anyone that, oh, I studied from wards anesthesia or from specific source. You just need to explain. Okay. And try to make things in funny way, in simple way. Like you should be knowing to explain in your native language, African language or Punjabi language or Arabic language or whatever language you are in. If you are able to understand any topic in that way, you will never forget. And try to add the, as I was saying to you, use your mobile to have audio notes. This is the best way that you read something after at the end, you just sum up whatever you have learned in an audio notes, put a date, put a topic, and put it in your folder. When you are not in study mode, you cannot open the book, you can still plug on your headphones and you can listen to what you recorded in last few days, and that will be your revision. That will be your revision. Okay. And this is the folder for the textbooks. So you will find almost whatever, though I am a big supporter, or you can say I am anti these concept of these so-called textbooks. These are not, rather you can say there is no specific source, because from where we started, that the basic thing, remember one thing, anesthesia needs hell of knowledge. If you want to be a good anesthetist, you should be knowing all the things from different perspectives. If you don't, you will be lacking. Okay. This is also a very good source. I will suggest you. I put this is FRCA mind maps from the Anesthesia UK website. It's not for all topics, but for whatever topics they have made it very nicely. You can make your own FRCA. You can make your own this one mind maps. Okay. Whenever you read any topic, just make a mind map, a summary like that. That if this topic is coming, these are the things which I should be knowing. Okay. So if anyone wants, they can have even a printout in color. If you like to have writing, so you can use this and you can add on. You can add on like that. Okay. You can just imagine that it was not an easy job to prepare all this and this topic wise questions. Okay. These are with reference to SAQs, but here, for example, just I'm giving you, for instance, for example, anemia. Okay. The topic of anemia. And if you make your questions for all the top, and you know, I invite all of you. Anyone wants me to make a specific topic or guide you for a specific topic, you all are welcome to drop a message in the group. I will suggest you to discuss cases, because that's how we will learn. All of us will learn. And remember one thing, sometimes if you are just in a stereotype way, you are opening the book, you are not in class 5, that you will open a book, you will get some notes and you will eat it or digest it and vomit it on the in the examiner. No, it's not like that. And remember one thing, maybe today you're not understanding, maybe after 10 years you will understand when you will become examiner, that if someone is just trying to show you only a cramming stuff, you will catch. You will definitely try to reconfirm whether this gentleman or gentle lady knows the concept, or he or she is only reproducing a book, lines written in a specific book. Okay. So like I'm giving you an example of anemia. So I can guarantee you that if you read a topic like that, you will not miss anything. Okay. So I think enough for today. If anyone wants to ask anything or have any comment, because actually, you know, remember one thing, you will find so many people who can tell you, if you are asking them what is the way to prepare, they will tell you the name of the books. Unfortunately, I'm not saying doubting their I'm not doubting their sincerity. But the thing is that this is a very easy job to tell you read this book or you read this book. But the problem is that there is no specific book for anything. You need to, like people, I will just tell you another thing. I forgot this thing because I did not open the folder of MCQs. MCQs. Okay, so you open this MCQs world and you will see so many folders different arranged. These are ICU MCQs, these are regional anesthesia MCQs. Like for instance, you want to have these regional clinical sciences MCQs. Okay, so you will open a number of books you have already. Okay, because now these are available in a number of places. But like this one was the latest one. You can use how you can use the MCQs. I think this will be the last thing which I tell, and then we will finish for today. And that how to how will you ask you to learn from MCQs, because sometimes you are just okay. For example, this is a MCQ which option is most characteristic of a perioperative myocardial infarction. Okay, so I don't know what will be the answer here. Occurs intraoperatively, is associated with ST elevation. The the patient complains of shortness of breath and chest pain, as a mortality of 25% occurs. The thing is that this is the buzzword, perioperative myocardial infarction. Now you should be trying, this will be like you learning objective for you. Try to learn how to manage perioperative myocardial infarction with reference of diagnosis, what to do, how to proceed with it. Not only the getting the answer. Okay, we can see what is the answer. Here, just a second. D. So what was the answer in this question is with reference to something data. I did not, because this is a new book, I have not read about it, but they are asking, they will, then you can get the a crazy explanation about it. Okay, but the thing is that if you want to learn from these MCQs, try to learn in that way, that you learn the topic, because not necessarily this MCQ will come, not necessarily. There will be some topic, some MCQ similar to that one, or some with the like and you something like something associated with it, this one. Okay, how to present long case in Viva exam. I think we will do it. I have discussed this a number of times before. If you open this is the channel. And by the way, I tell this thing loud and clear to all of you. This is not a monetized channel. This is not no, it's not a monetized channel. So if I offer you to study or use it, I have no conflict of interest. Okay, because this is my purity. This is which is my selling point, that I don't want to. So you will go to the playlist and you will find here Viva practice. So I have explained in detail. um Actually, this is from the content. You will go in this playlist. You will find a number of things which you are asking. Okay, I have discussed, and later on I can even repeat these things. Okay, here is the paper that explains pre-op approach. Yes, just a second. Not pre-operative. You can say peri-operative planning. Okay, so this is you will go to this how to study. Uh, just a second. You need just maybe 30 minutes to understand where are different things. But unfortunately, people even don't want to spend their precious time. Okay, so it's a very disheartening thing. Okay, so you will just click here, how to study, and there are actually two different folders, two different files. One is with the all the history and examination. Okay, this is one file, and other file is this one. Okay, so I suggest you can modify according to your understanding, but try to whenever you are having any case, try to fill this paper. What are the concerns with reference to everything, and you will get a lot of benefit, I tell you. Okay, okay, everyone, thanks a lot for your time, and don't hesitate to ask any question anytime. Okay, and I will just try to like if anyone wants to discuss any specific topic, you all are welcome to message me. I will try to do. Okay. Okay, so thanks a lot, all of you. Inshallah, we will meet again. Assalamu alaikum.